Hello everyone, how are you? Many individuals asking that is entrance exam tough? I always mentioning yes, entrance exams are tough, but that's not the all things that we have to understand. What really matters, that is your intention, your effort and your ability to keep going even it's get hard. So those individuals who are passionate enough in psychology, yes, entrance is tough, but what kind of intention they are having, what kind of desire, what kind of goal they are having, they make this process enjoyable. Even if any individual don't understand a topic in first attempt, I always mentioning it's okay. It's completely okay. Understanding takes time. Important is you are trying every day. So no matter we are understanding any component, any concept in first attempt, if you are trying, if you are moving toward your goal and if you are taking action in that particular way, that's enough. This is the main thing. And whenever it feels like too much, sometimes it happens because so many exams are just approaching. So in this process, whenever I'm talking to any students, they are mentioning it's feel like too much, they are overwhelming. Remind yourself, always say to yourself, it is not just about clearing an exam. It's about becoming the person you always wanted to be. So from so long, we just see ourselves at a particular point, reaching at a particular place. So this is not exam. You are just moving toward your goal and you have to enjoy this process. And whenever you start thinking in this way that I'm just moving toward my goal, I'm not participating in any exam, but yes, this exam is a milestone that I have to cross, but gradually, slowly, I'm just moving toward my goal. That makes sense. So let's move. Here, today we will discuss from question number 51 that you see here. But before moving with this question, I would like to say hi to Arjun. Hello Arjun, how are you? Mastery Universe, thank you for motivation and guidance. Mastery Universe, you are self-motivated. That's why we all are here, right? Whenever we are taking this kind of lecture, I always saying to students, like you are having so many options. You can watch reels, you can watch any entertainment related videos, you can see comedy, but you are here just because you want to learn something. So you are motivated and I appreciate you selected this video to watch. Not only this video, whenever you use internet to learn something, right? We all need to appreciate this kind of act, right? So you are self-motivated and wish you all the best for upcoming exam and future aspirations that you are having. Okay, so question number 51, here you can see, in the context of the resting membrane potential, which of the following best describes the charge inside a neuron relative to the outside? You are having these few options: neutral, positive, negative and alternating. We all are aware resting potential means your neuron is not firing right now, but they are ready. Whenever they will get any messages, they will fire. Action potential means they are firing right now. So we are discussing about resting potential. So at resting potential, inside of a neuron is negatively charged relative to the outside. And this is mainly due to unequal distribution of ions. Specifically, more sodium ions will be outside. Let's take an example. So more sodium ions will be outside. This kind of condition will be there in comparison of, right, there will be more potassium ion and negatively charged protein inside, right? So this kind of condition will be there. So here if you will see, so you can identify outside relatively there are more positivity in comparison of inside. So in this particular situation, the correct answer will be C, negative, because question mentioning in the context of the resting membrane potential, which of the following best describe the charge inside a neuron relative to the outside. So here you can see inside the neuron there are negative, right? When we are talking about relative, so relative negative we can find in comparison of outside. So there are more positivity outside in comparison of inside. So we can say C will be the right answer, negative. Next, in schizoaffective disorder, how long must delusion or hallucination be present without a major mood episode for diagnosis? Many individuals having confusion understanding schizoaffective disorder because there will be mood related problem like mania, depression, as well as individual having problem to understand how schizoaffective disorder is different from when individual having depression with psychotic feature, because when individual having depression with psychotic feature, they are having mood related problem as well as hallucination, delusion. When any individual having schizoaffective disorder, they are having hallucination, delusion, but they are having mood related problem. So first of all, we will try to understand what will be the right answer, and in the process you will get the idea how schizoaffective disorder is different from depression with psychotic feature and mood episode with psychotic feature. Here you can see I am just repeating the question again. In schizoaffective disorder, how long must delusion or hallucination be present without a major mood episode for diagnosis? Option A mentioning at least 1 week, B at least 2 weeks, C at least 1 month, D mentioning at least 6 months. In schizoaffective disorder, delusion or hallucination must be present for at least 2 weeks. So this is the straightforward response. So correct answer will be B, at least 2 weeks. This is major point in diagnostic criteria, but we have to understand, as question also mentioning, individual having delusion, hallucination, that will be there at least for 2 weeks without any major mood episode. Major mood episode means depression or mania, right? So if there will be hallucination, delusion in the absence of major mood episode, then only diagnostic criteria will met as given in the statement as well. And this feature help us differentiate it from the mood disorder, right? Mood disorder with psychotic feature. So when psychosis occur exclusively during mood episode, what happen in mood disorder with psychotic feature, there will be mood related problem, and when there are mood related problem, there will be hallucination and delusion. But here we are discussing individual having hallucination and delusion without a major mood episode for diagnosis. So that is the basic difference. Correct answer will be B, at least 2 weeks, right? Whenever I am presenting any question, and if you know their answer, mention in chat box. I always going through your comment. I always try to read your comments if you are having any doubt that I haven't taken. So I try to read them, and I requesting the team that if possible, reply that particular queries, reply that particular issues if any individual mentioning in comment box. So if you are having any doubt, any queries apart from this discussion, you can mention in comment box. We can discuss at the end, or right, we will reply on them. Question number 53. Here we can see a 7-year-old boy shows 8 months of defiance, aggression toward adult, and frequent arguments at home and school without violating others' rights. What is the most likely diagnosis? Now here you can see options are conduct disorder, oppositional defiant disorder, disruptive mood dysregulation disorder, and ADHD. This question looks simple, but sometimes few students having difficulty and they are choosing the wrong answer. Here you can see all these characteristics that we are finding, all the symptoms that you can see. Here you can see defiance, aggression toward adult, frequent arguments at home and school, right? All these things you can find that could be in multiple problem that you can find in different disorders. But what will be the right answer? First of all, you have to understand the right answer is B, oppositional defiant disorder. Sometimes individual thinks conduct disorder and they choose this option, but conduct disorder in this case is not the right one, right? Why? First of all, we will try to understand why oppositional defiant and how oppositional defiant disorder is different from conduct. So when we talk about the symptom that is already described here, like defiance, aggression toward others, frequent arguments, that align with oppositional defiant disorder, in short we can say ODD, right, which typically involve a pattern of angry, irritable mood, argumentative behavior and vindictiveness, right, and all these symptoms must be there from at least 6 months. Now we can say why conduct disorder will not be answered. So this is different from conduct disorder because there is no violation of others' rights or aggression toward others' property that you can see here, right, without violating others' right. So when individual having all these symptoms and they are not violating other individuals' right and they are not harming and damaging other property, then chances are very high that they will diagnosed in oppositional defiant disorder ODD. Right? Hope you understood it. If you are having any doubt related to it or related to any question, you can mention in chat box. Question number 54. A 24-year-old man is unable to recall his name or any personal detail following a traumatic event. He later finds that his memories return gradually. What is the most likely diagnosis? Option A, dissociative identity disorder. Option B, dissociative amnesia. Option C, post-traumatic stress disorder. And option C, depersonalization, derealization disorder. Whenever you are going to answer this question, we have to keep focus on few things. I'm just going to highlight them. A 24-year-old man is unable to recall, this is memory related problem, right, his name or any personal detail following a traumatic event. That means after traumatic event this situation occurred. So after traumatic event, now they are not able to recall crucial information like information related to their name, address, phone number and so other informations, right. He later find that his memories return gradually. What is the most likely diagnosis? So there are two highlights that we have to focus. Memory related problem, and that happen after stress or extreme traumatic event, extreme trauma. So here you can see dissociative identity disorder, dissociative amnesia, post-traumatic stress disorder and depersonalization realization disorder. If we are having all these, first of all, we can find there are few disorders that is connected to dissociation and few not, right. So when we talk about post-traumatic, depersonalization, derealization, in those memory related problem you can find, but you know what kind of statement we are giving, that is not close to post-traumatic stress and depersonalization, derealization disorder. If any individual having confusion in dissociative identity disorder and dissociative amnesia, we all are aware when any individual mainly having memory related problem just because of dissociation. So we can diagnose individual in dissociative amnesia, chances are higher. So most likely diagnosis is dissociative amnesia, we can say, that involve the inability to recall important personal information, typically after traumatic events or after a stressful event. This is the major explanation of dissociative amnesia. So the memory loss is usually related to a specific detail, or maybe memory loss will be very wider, but we can easily identify that they are not able to recall any information, personal history, or maybe their name, maybe phone number, just because of certain stress and certain trauma. But when trauma will go away and when they will came out from the trauma, when they will came out from the stress, then we can find that now their memory coming back gradually. So that was the effect of dissociation. Just because of dissociation they forget and they are not able to recall those crucial information. So correct answer will be dissociative amnesia. The closest one is dissociative amnesia. A therapist uses technique like role playing and focusing on the here, and now to help a client gain awareness of their thoughts, feeling, and actions. This approach is characteristics of cognitive behavior therapy, gestalt therapy, dialectical behavior therapy, and systematic desensitization. One thing I would like to mention here, sometimes what happen, question will be too easy, but we think question is easy, and I know what is the right answer because right, we think I'm having the appropriate information related to it. So we are not processing deeper analysis related to those questions because हमें लगता है कि ठीक है मुझे आता है, I know the answer of this. So sometime when you are confident enough, हमें लगता है कि नहीं मुझे तो पता ही है. In those particular situation, we are not analyzing in a way जैसे हमें करना चाहिए, and then we are doing mistake. In this particular questions, whenever I'm asking this question in my class or right through at other platforms, multiple time I found that many individuals choosing cognitive behavioral therapy and they are confident enough कि यही answer होगा, but that is the wrong answer. Here you can see what a statement mentioning a therapist uses technique like role playing and focusing on here and now. So when we talk about role playing and here and now, that is not the major component of cognitive behavior therapy, right? Next you can see to help a client gain awareness of their thoughts, feeling, and action. This approach is characterized of gestalt therapy. Gestalt therapy will be the right answer. Gestalt therapy emphasizes awareness, personal responsibility, and living in the present moment. So technique like here you can see role playing, technique like role playing, and technique like here and now, right? As well as there is one more technique, we call them empty chair technique, right? That focusing, and we are focusing in this particular approach, or we can say these are role playing, here and now, and empty chair technique. These are the central to this particular approach. That's why we will choose gestalt therapy. Gestalt therapy will be right answer. Fine. So I would like to say hi to Hudaya. Hello. Anukriti Jaiswal. Hi Anukriti. Vijay. Andrelia. Rima. Hello. Minu is here. Hello Minu. So yes, you are responding and you are mentioning your response and your answer in comment box. That's great. Nikki mentioning why not disruptive mood regulation disorder. Disruptive mood regulation disorder is not the right answer. I would like to show that particular going back and just explaining. Here you are mentioning why disruptive mood dysregulation disorder is not there, right? Because here we are finding a 7-year-old boy shows 8 months of a 7-year-old boy shows 8 months of deficiency, aggression toward adult, and frequent argument at home and school without violating other rights. What is the most likely diagnosis? So when we talk about disruption and mood dysregulation disorder, so there will be irritation, frustration, anger, we can say. But when we talk about all these as a whole, defiance, right, and frequent arguments, so usually we are finding these particular, and one more thing that I would like to mention, in exam it will happen. There will be more than one correct if you think that is going to connected with 2 disorder, right? These are the symptom of 2 disorder. In those particular situation, you have to choose best one, because here you can see we are having these 4 options. We don't have right option of both. But sometime in examination, if any symptoms will be connected to 2 disorders, then there will be coding 1 and 2, 2 and 3, 1, 2 and 3. So in those particular situations, scenario will be changed. But right now, if you have to move with all these, oppositional defiant disorder is more closest, because right, all these that we are discussing, that is related to undisciplinary act. Sometimes just because of these, that will be, you know, very close to, or they are performing antisocial behavior, they are involved in those particular act, but at the same time they are not violating others' rights. Basically, in disruptive mood dysregulation disorder, we are not mainly talking about other rights. So that is not a point of diagnosis in disruptive mood dysregulation disorder. So if they are mentioning these points, so there are a meaning. We have to consider these points as well. Without discussing and without taking this particular point into consideration, we cannot diagnose. That's why the more relatable option will be oppositional defiant disorder. Next, a researcher tests participants from different age group 20 to 30, 40 to 50 and 60 to 70 at one point in time to study how age affect word recall. That type of research design is this. What type of research design is this? Option A, longitudinal study. Option B, cross-sectional study. Option C, experimental study. Option D, correlational study. Right? Whenever you will observe the statement that you are having, the correct answer, first of all, I would like to mention the right answer. Correct answer will be cross-sectional study. A cross-sectional study involves testing or observing different group at the same time. We all are aware about it, right? Whenever we are using and we are saying this is cross-sectional study, that means we are involved in testing and observing different group at the same time. And here you can see participants from various age group, 20 to 30, 30 to 40 and 60 to 70. That tested wants to compare word recall across ages. As you can see here, one point in time to study how age affect word recall. So we are studying all these individuals to understand how different age is going to impact word recall. So this will be cross-sectional study. I am just repeating it. Cross-sectional study means we are involved in testing and observing different group at the same time, right? So correct answer will be cross-sectional studies. Okay. Aditi experiences mood swings altering between depressive episodes and periods of extreme energy, impulsivity and irritability with rare symptom-free periods. With which diagnosis fits this pattern? I'm just repeating this statement again. Aditi experiences mood swings altering between depressive episode and period of extreme energy, impulsivity and irritability with rare symptom-free episode. Which diagnosis fit these patterns? If you will move with this, you will be aware that there is a depressive episode. That is the first major things. And second that you can find extreme energy, impulsivity and irritability. So in a group, we can say this is mania. This is mania. That means individual moving from one extreme to another extreme. In this particular situation, there will be all these you can see bipolar 1, bipolar 2, cyclothymic, all these are could be, and these kind of symptoms we can find in those majorly bipolar 1, bipolar 2 and cyclothymic disorder. But whenever we are moving with diagnostic criteria of bipolar, so we complete diagnosis and we diagnose individual in bipolar 1 on the basis of mania and major depressive episode. So there are three things that we are moving, right, when we are diagnose any individual in bipolar: mania, hypomania and major depressive episodes. So here you can clearly identify there is a mania and there is depressive episode. So when individual having depressive episode and mania, with here you can see with rare symptoms free periods. So when these all will be combined, we can say that will be bipolar 1 disorder, right? If they will be hypomania, because this don't look like hypomania. Hypomania ka, right, what is hypomania? Hypomania is the less intensified symptoms of mania, as well as for the lesser duration. So duration in comparison of mania and intensity in comparison of mania will be lower, right? That will be milder. That is milder form of mania, we can say. Hypomania is a milder form of mania. So when we look into all these symptoms, then we can say the closest one is bipolar 1. Next, when people attribute their own behavior to external factors but others' behavior to internal characteristics, this is known as A. Fundamental attribution error, B. Actor-observer bias, C. Self-serving bias, and D. Just world hypothesis. This question is really very interesting, and you might read and you will be aware, you read in social psychology. Correct answer is actor-observer bias. What happened? In actor-observer bias or actor-observer bias occurs when people attribute their own action to external factor as given in this statement, and other individuals' behavior to internal. Like, we can take one example to understand it. Suppose that if someone is late, then individuals who are using actor-observer bias, they might explain it is just due to traffic. Suppose that if any individual late, so they will explain I am late just because of heavy traffic. But if other individual will be late, then they might think that individual is late because they are irresponsible, right? They are not responsible enough. So when any individual looking into their own mistake, they are considering them external, and when any individual looking in other individuals' mistake, they consider them internal. That is actor-observer bias. So correct answer is B. Question is, the tip of the tongue phenomenon is an example of. The tip of the tongue phenomenon is an example of option A, retrieval failure, option B, encoding failure, option C, recognition memory, option D, false memory. Correct answer is retrieval failure. A is the right answer. Correct answer is A. A is the right answer. Why? The tip of the tongue phenomenon occurs when a person is unable to retrieve any piece of information from the memory, even though they feel they know this particular information, but they are not able to recall. Sometimes it happens to us. किसने पूछा उसका नाम क्या था? So we think हाँ मुझे पता तो था, I know their name, but right now I am not able to recall. So this happened right here in tip of the tongue phenomenon. So individual facing problem related to retrieval failure. So this is a classic example of retrieval failure, we can say, where the information is stored in your memory. You know I am having information, but that is not accessible. So we can say that is temporarily inaccessible. So this is retrieval failure. The tip of the tongue phenomenon is an example of retrieval failure. And last question for today, you can see, Srishti is solving a puzzle while remembering a list of words. Which component of Baddeley's working memory model coordinate this information? You have to read this particular statement very carefully, right? Srishti is solving a puzzle. So there are few keywords. They are solving a puzzle while remembering a list of words, remembering something. So there are two keywords, na? Solving puzzle and remembering something. Which component of Baddeley working memory model coordinate this information? So we have to choose those who are coordinating between these two information. So when we talk about solving a puzzle, so visual, right, is important, and spatial is important, right? Visual spatial is important. Visual spatial kind of activity we are performing when we are solving the puzzle, as well as when we talk about the remembering. So at that time we are using we can say verbal information. So this is connected to remembering, is connected to phonological loop. Phonological loop, right? And when we talk about visual and spatial or spatial, we can say, so we can say this is visual spatial sketchpad, visual spatial sketchpad. Sketchpad. Now we have to understand one thing, right? If you know about this particular theory, so you are aware there will be one central executive, and central executive is controlling three things mainly, right? First, phonological loop, second, visual spatial sketchpad, and third is episodic buffer. So whenever we are talking about which section and which element in Baddeley approach perform coordination between different kind of information, that will be central executive. Central executive is responsible to coordination, to establish coordination between different component. So we can say the right answer will be A, central executive, right? So in this case, central executive will be right one. Fine? Okay. Okay, so you all are trying, right? Okay, Ishita, Rima, Mystery Universe, Bhavarthi, Ramesh Kumar. Okay, so I hope you learned something. Guys, so many exams are approaching. No matter you are going to participate this year or you are doing preparation for the next year, or you are just here just because of curiosity, you want to learn psychology, we have to understand one thing. Whenever we are choosing any goal for us, right, that journey will not be smooth, right? If any individual having this kind of expectations that my journey will be smooth, maybe within few days and weeks they will realize कि नहीं, ऐसा तो बिल्कुल भी नहीं है. So if you are deciding something for you, if you are making a goal that is not easy to reach, and usually we are not dreaming for something that is too easy to achieve in our life. So if we are having a certain dream, we are having a certain goal, right, जहाँ तक हम पहुँचना चाहते हैं, I think what kind of experiences I am having, we enjoy the process, and this is the main thing. If we are not enjoying the process, then there will be difficulty. We feel boredom, monotony, fatigue, frustration, irritation. So I always mentioning to everyone, if you are having a goal, make their journey enjoyable, right? वहाँ पहुँच के, yes, you can do what you want to do. Whenever you will get license, or whenever you become psychologist, or whenever you become lecturer, or when you will, right, get any post, so you will perform your action, that will be rewarding. But this journey, when we are trying to reach somewhere, if that journey is enjoyable, then this process will be easy, smooth, and right, you will enjoy the process at the same time. So that's all for today, right? If you're having any doubt, any query, do not hesitate to mention in chat box, right? So see you in next class. Bye. Take care everyone.